Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Khan, non-stop show 926th episode. Let's have the headlines of the day. Delhi hospitals witness spike in emergency patients as air pollution increases. As a report from AIMS. The approved Pfizer Incan drug, branded as Litflo, has been approved by UK's Medicines and Health fluconazole tablets used in the treatment of fungal infections. US FDA skin disorders besides skin manifestations may be an initial sign of diabetes in undiagnosed patients. Let's go to the topic of the day. We will be talking about different skin diseases in women. औरतों में क्या क्या चर्म रोग की बीमारियां हो सकती हैं और इनके बारे में आज हमें बताने के लिए आए हैं डॉक्टर रविचंद्रन जी. Dr. Ravichandran G is a highly recognized dermatologist in Chennai, boasting about 23 years of experience. His practice extends far beyond conventional dermatology, encompassing specialized surgical treatments for various aesthetic and cosmetic concerns, including mole and scar removal. Skin conditions such as vitiligo are treated by him. His dedication to delivering exceptional patient care is underscored by his extensive career, which includes more than 200 surgeries. Furthermore, Dr. Ravichandran also serves as a reviewer for the Indian Journal of Dermatology, Venereology, and Leprosy, and co-authoring the Davidson Textbook of Medicine. His wealth of clinical experience and commitment to is often looked as an aspect of dermatological care, which makes him a prominent consultant at Apollo Group of Hospitals. So, welcome, sir. I'm so happy you are here to talk about the common problems that females face. Females, as it is, are so particular about their looks and their skin. So, let us start. I have a group of questions posted by our listeners. The first question, sir, is what are the most common skin diseases that affect women, and how can one differentiate between a common skin issue and a potentially serious skin disease?
Uh, Thank you, Dr. Anita Kant, for inviting me to this platform. And of course, IJCP also I must thank and happy to be here today in this very nice platform. And the topic is very interesting that women's health. People are doctors across India, across the world are talking about women's health. It's the most important, and of course, the mothers, always play a major role in our day-to-day activities in our life. We pay our respects to all the women and mothers who cared us, and we also start taking care. And this is a topic which I thought probably skin diseases in women. His skin is the largest organ in the body. Across age, whether the newborn baby, we like to pinch the skin of the newborn, and you see the old man, lady, who's got so much wrinkles, so much graying, so much, but still the glow in the skin is very aptly seen in the 90s and hundreds of the women, particularly. So beauty adds beauty to the wrinkles add beauty to her. That's okay. So this is what are the common skin problems we face in the women's, depending upon the age. We have the teenage. Nowadays, we see a lot of young girls who come to us for help. And then, of course, the young women, and of course, middle-aged women, and the late age. So these are the four ages where the women also go through the affection of the skin, where I will be addressing it quickly. What are the common problems? The young individual, young lady who walks to my room with the sweet 16, have a common issue is the acne. Doctor, I have acne. I have pimples, doctor. There are girls who just come, there are only one or two pimples, they are so much alarmed because it is going to damage their skin, because it can give a pigmentation, it can give a scar, or it can be very severe acne, mild, moderate, or severe acne vulgaris, and associated with it sometimes dandruff. This is due to the androgen hormone secretion. Apart from that, the lifestyle modification, and then all these agents they use across the board, and resulting in a lot of complications. We have to clearly tell them that this is a condition which is going to be there from the sweet 16 till for a few more years. Don't be in a hurry. Don't do any kind of activity. So we have a very good setup. So we have grade 1, grade 2, grade 3, and grade 4 acne vulgaris, comedones, papules, pustules, nodules, cyst, and scar. What is our, as a dermatologist, what we do, we should not allow the scars to form. Scarring has to be completely banned, because any pimple can result in a deep pits called post acne scars and pigmentation. We are able to treat the acne so very, very well, but any acne will definitely leave the pigmentation. So we have very good treatment options available, and we have a topicals, we have antibiotics, we have the best option if it's severe acne. We have a condition called roaccutane. Isotretinoin is the drug of choice for young women. We always do not use it for a middle-aged women, but particularly young girls, and who want to have a clear skin, clear face. So therapy is very, very effective. Pigmentation also can be related to the acne, and the dandruff is a very common issue in them, called seborrheic dermatitis. Seborrheic dermatitis also occurs along with acne vulgaris in young girls, so that has to be attested. Even acne can go late acne. We talk about acne which is late acne in women who are past 25, 30, probably related to some, as you correctly said, hormone change. So hormonal acne is a very common in women who are past 30, 35, and 40. It is due to some condition called polycystic ovarian syndrome. So please see a small gynecologist or an endocrinologist to identify whether it is also related to acne, hormone acne. Then we need to look into that, the lifestyle diseases associated with other conditions. It can easily be managed with the topical and oral tablets along with the internal medications. We want the post acne marks to go away, because there's a marriage issue coming up, then the parents are a little upset. So we address every issue so that acne to be treated in the correct perspective, so that we give the acne scar face, acne free pigment face, and get a glow. A lot of aesthetic and cosmetic procedures are also available to treat acne. We have the chemical peels are available, glycolic peels, and we have lasers, scars to be removed with microneedling, MNRF, fractional carbon dioxide. It's mind-boggling. The recent developments have done so much. You see, we always use these depending upon the condition of the young girls or women who come to us. Hormone acne is a very commonly seen. We always give a little spironolactone or OCP pills if they are associated hormone irregularity or cycles irregularity. And obesity and young women, no, particularly there is a high glycemic index, no, obesity, dietary advice, lifestyle modification, stress, all add up to the acne flare up. So one has to be address these issues like the diet and the exercise, and very, very important that they shouldn't take high glycemic containing food, index containing foods like chocolates, sweets, and of course frequent washing, keeping very clean, personal hygiene, workouts are very important. We have good array of medications, both topical and oral medication, safely we can use in these people, so that they don't go into any kind of a post acne complications.
So there are some women who always have a challenge of sensitive skin. You know, it may be they use some products which lead to the sensitivity. They say even if they walk out into the sun, they get rashes on their face and arms. So are there some products or treatments designed for these women with special sensitive skins?
Yes, it's a very good, interesting topic, because whenever we try and identify the condition on the face, sensitive skin mange is one of the important factor, because we are not even able to use some of the products on their skin. It suddenly flares up, burns, and it is also related to the photosensitivity. So we quite end. The one of the commonest condition in teenage and middle-aged women is seborrheic dermatitis. There is inflammation of the skin on the face, along with whatever it is. They are so sensitive, and products whichever available in the cosmetic across the counter or whatever we use causing so much severe sensitivity. That is why one of the common factor here is the hydration. We have to hydrate the skin properly and use proper sunscreens, and make sure they don't use kind of a deos and perfumes and aftershave these things. This is very important that hyaluronic acid is one of the best agent to use for a sensitive skin, and a good moist based sunscreens have to be used. And if there's any inflammatory conditions like seborrheic dermatitis or mild acne, we have to treat them properly, and so that we quieten the skin so that they are not hypersensitive, so that we can retinoid. So people always use this kind of topical retinol. So this causes irritation. The women who are using isotretinoin also have a sensitive skin, dry lips, photosensitivity. All these problems can be easily addressed, but they have to be very clear that they should not use any product which is across the counter, and consult a qualified dermatologist.
Right. So after menopause, hormonal changes occur and estrogen is lost, which keeps the glow of the skin and keeps on, rejuvenating the skin by taking away the inflammation and everything. So they usually tend to get wrinkles. Uh, People who are in that industry and need to keep a smiling and, full face, they go for some injections and all, but Botox, etc. But what would you suggest to a normal housewife or a working woman, how she can make her skin still glow despite her aging and
Yeah,
absence of
yes,
hormones?
very interesting, because the anti-wrinkle regimen has come very popular nowadays, but they,
Mhm.
to avoid and premature aging and wrinkles to be, we should postpone, because you should use it all the your skin care is very important, and it should be hydrated well, and we should be using a good sunscreen and astringent. So we have to be this begins in the early life. It's not that suppose if we start the all these methods by age of 30, probably at the age of perimenopausal time this can all be is prevented. The water intake is important. Proper collagen induction is very important. If you are maintaining a good healthy diet, if we always age with grace. So one has to be very clear that we have other options available to treat the wrinkles, the crow's feet, aging thing, wrinkles, neck folds. All are can be easily managed by using a good sunscreen, a moisturizer, hyaluronic based chemical peels. Glycolic peels are very useful to reduce the mild fine wrinkles, as well as laser energy based devices are available. If it is sagging skin and a lot of folds are there, we always give fillers, we always give botulinum toxin, but that is a temporary issue. If it's a little disturbing to the psyche of the women, we always go for the interventional therapy in the form of a procedural therapy. Lasers are very useful, particularly in the fair skin individual. Darker skin individuals may get complications following laser resurfacing. These procedures are office based one, but it has to be continued regularly on regular session. If you wanted to take a facial fillers or a botulinum toxin, it starts probably 9 months to 1 year. So that is tied over in the crisis. If there's a function at home, we can always grow. The other component in the middle-aged women is the during pregnancy called the melasma. Madam was telling me this about the very common thing is the facial melanosis called facial pigmentation. This is very alarming because it's causing so much of it's the most difficult condition also to treat. If we can treat a melasma at the early stage, we are able to reverse it. Otherwise it remains, if it is there for years together, the brown patch on the cheeks of the young women or middle-aged women called melasma, called in it's called, they say sometimes it causes bad woman or null. So it's not like that. It is due to the hormones and related to the sun exposure. Sun exposure has to be, of course, vitamin D is very important, but if the supplementation also is to be done with vitamin D supplementation, melasma to be treated with a liberal use of sunscreen. A sunscreen of 30 SPF to 50 SPF to be done every 4 hours. 30 minutes before the women have to go to the kitchen, or in the working in the sunlight, or sitting in the professional can sit in the system for computers for long hours. Radiation is one of the commonest condition that sunscreen to be used minimum 3 times a day, 30 minutes before you intend to go to the sunlight. So that is one area. And moisturizing, I was just telling you, any kind of moisturizers. And melasma to be treated with topical agents, we have a hydroquinone based one, we have a retinoid based one, we have so many issues are available, products are available, but carefully we should do. Lasers are available, chemical peels are available. I think it's very interesting that melasma can easily be treated, and if it is not very amenable, we can always use a camouflage cream to mask the pigmentation.
Very nicely explained. So, can pregnancy affect a woman's skin and lead to skin-related issues?
Yes, yes. Pregnancy, during pregnancy and post pregnancy care is very, very important. Skin during pregnancy is so much, no? So, pigmentation is a very common because of the melanocyte stimulating hormone, which causes linea alba, the pigmentation, which is very commonly seen. Stretch marks, stray can come, definitely come. It can also be causing permanent scarring. And then the pigmentation, then the hair loss, there are specific dermatosis of pregnancy like hives, all can easily be treated, and proper care from the beginning is very important. Melasma, usually pregnancy called the chloasma, disappears after delivery, and it's very unlikely that it will permanently result in a melasmic pigmentation on the young women who deliver the baby.
So, next that I want to talk about is, are there any links between thyroid disorder in women and skin conditions? And what
Yes.
should women be aware of in this
Yeah,
condition?
thyroid is a very common, hypothyroidism, autoimmune hypothyroidism, very common in
Yes.
women. And it is also one of the cause when associated with melasma and facial pigmentation. And of course, hair disorder, hair fall. We'll come to the topic of hair care in another 2 minutes. And this pigmentation is very, very common with melasma. And if there is associated with hypothyroidism and obesity, with the insulin resistance, particularly women who are overweight and they have a peripheral insulin resistance. So they also have a PCOS. So all this go together, causing a darkening of the neck, darkening of the face, and obesity and insulin resistance have to be addressed, and proper diet. And of course, we have a metformin medication is needed, which will definitely change their outlook of the appearance of the skin as well as the weight reduction. This is a hair loss is very commonly seen with hypothyroidism,
Yes.
and which is also very commonly seen with the anemia. Iron deficiency anemia is a very common condition when women have got hypothyroidism, and this is again to be corrected. I think should be okay, and of course we give treatment for the whatever condition, pigmentary conditions or any other issues we tackle.
Sometimes women suffer from autoimmune diseases, rheumatoid arthritis being one of them. So, can they also have some common skin manifestations along with their autoimmune, and how to manage those?
Yes, the autoimmune commonest is women is autoimmune Hashimoto's thyroiditis, where autoimmune disorder is very common. They have a excessive dry skin called xerosis, particularly during winter climate. Their skin is so dry and chapping because the hand eczema is very, very common. People who work in the kitchen know they get so much. We've been using a lot of hand sanitizer during COVID times. Many women comes with a hand problem. They are very sensitive skin. They have a water contamination, and then they have this paronychia or nail fold swellings, and if they are diabetics, they have frequent fungal infections on the hand. All can easily be treated very, very well. Hormones, of course, definitely causes so much problem in women, and whether it is thyroid or PCOS, estrogen progesterone abnormality, vitamin D associated deficiency, ill health, anemia, all can easily be done, and can be good prescription is can be given from both by gynecologist and endocrinologist and dermatologist, so to get a glowing good skin.
So now, like in Delhi, at least we are living under a pollution fog. And I don't know about Chennai, but many states are facing this problem. So environmental factors, and also when this fog, this pollution is not there, sun exposure, how can they impact a woman's skin?
Yes, they are all called toxins, no? So this is
Yes.
called the pollution in the form of air pollution and sun exposure. UV radiation can definitely have an impact on not only on the facial skin, the whole system, particularly respiratory allergy, and then the skin allergy, eczema, atopic dermatitis in women can cause in milder form or a severe form. This The barrier skin barrier is to be maintained very well. The commonest factor is here emollient usage. Emollient usage is very important. In If you can go to Kerala, women always use this coconut oil. They always dribble
Yes.
with coconut oil on the hair and facial skin. Of course, if the skin is quiet, you can use an emollient. We always use a moisturizer based pepper, the ceramides based moisturizer are very effective, maintaining the skin integrity in the form of filaggrin. Ceramide based moisturizers are very effective. Hyaluronic based moisturizers are very effective. Application 2-3 times a day is very important. And then hair care also is very important, that we use a sulfate free shampoos, and keep the any dandruff is there, we treat with the ketoconazole shampoo. I think this is a very pollution can definitely have good sunscreen, wearing a goggle, and maintaining a healthy diet and antioxidants. Antioxidants containing beta carotene, particularly, we always advise them to take papaya fruit. No, papaya is rich in
Yes.
tomatoes in beta carotene, and they will definitely help you to tide over that effect, the free radical quenching effect by vitamin C, papaya, vitamin A, and zinc also plays a major role in maintaining defense against the air pollution.
That's very nice, sir. Can stress and mental health issues have an impact on a woman's skin?
Yes, stress in young women, college girls can result in acne flare up, pimples flare up. Stress, of course, the glow on the skin goes away because all are transmitted by the neurohumoral pathway. So that is why stress can affect in many ways. So find out how you can avoid the anxiety or stress from the counselors or the psychiatrist. And if you have a problem to address, we have to address this problem. And sleep is the most important agent to heal. Best healer is sleep. A good night's sleep of around 6 to 7 hours is ideal. Suppose this, and late night hours, opening, keeping the thing 2 o'clock in the midnight, burning the midnight oil, definitely have an ill health, because all the pituitary hormones are secreted during the night time, which read growth hormones. Very important that this is to be sleep deficit should never be done. And the proper sleep and intake of water fluids very important, with minerals, and a minimum 2 to 3 liters of fluids in the form of juices have to be done. Hydration will also hydrate the skin quality, the wrinkles will not be there. And proper diet rich with balanced diet with proteins, carbohydrates, fat, and minerals and vitamins is an important agent in treating. If there's any deficiency of vitamin D, we should correct, because vitamin D plays a good agent against the
Okay.
defense. So one of the good defense mechanisms.
Okay, that's something new, sir, that I learned from you. And what role does nutrition, besides vitamin D, what role does nutrition play in maintaining good skin health for women? Something about antioxidants or whatever you think is necessary. Please tell
Zinc
us.
deficiency is also very common because we
Okay.
avoid zinc, no. So dietary legumes and
Hmm.
nuts and spices. So antioxidant, the nuts are very important in antioxidants, like your pista, badam. All
Hmm.
these things have not in
Hmm.
overindulgence, but properly must take
Hmm.
high fiber diet, high fluid intake, fruits. I think with the balanced protein, fat, and sugar to be avoided. High glycemic containing foods. People are fond of eating sugar. So the sweets, particularly in middle-aged women, though if they are not diabetics, of course, diabetics definitely will avoid eating sugars, cakes and fruits and chocolates. But we make sure that less glycemic containing food is very important to give a proper diet.
So, how can women protect themselves from skin cancer? And what are the warning signs for skin cancer?
Yeah, it's a very, of course, we in India are blessed with the melanin. So we are protected naturally by the hereditary our race. Sometimes we do see skin cancers, in particularly fair skin individuals who've been in the sunlight for years together, and they are very commonly seen basal cell carcinoma. Melanoma is very, very rare, but I do see lots of men and women from northeast where there is a uh, water containing arsenic content. So high arsenic content, particularly in this belt of Burma, then Bangladesh and Calcutta area, those days. So those people come to us with the help of a lot of skin cancer, basal cell, Bowen's disease, squamous cell carcinoma. Of course, melanoma we don't see much in our society. It's more for Western skin. And if there is any kind of a mole which changes its color, and we have to be very careful. If any suspicion is there, we do see melanoma that is not related, but sunlight, chronic sun damage, photo damage, UV damage, UVB and UVA can trigger a kind of skin malignancy. Any suspicion, always please go to a dermatologist for a thorough checkup. And if you have an albino, you have a family history of a skin cancer, one has to be very clear, and proper examination is very important. If you have developed a basal cell carcinoma or Bowen's disease, excised and treated, periodic yearly checkup is important for them. Avoiding the sun UV exposure is very, very important. Broad brimmed hat, good sunscreens, wear a light colored white clothes, cover yourself so that we prevent the commonest triggering factor is ultraviolet rays in a kind in an Indian scenario.
So, sir, actually nowadays the emerging trend is that natural remedies are good. And in the search of natural remedies, women tend to get treatment from their beauticians. So, I would say your take on going to a qualified dermatologist to avoid complications. What do you suggest about that?
Definitely, beautician, definitely grooming is very important. Though you look good, you feel better. So that's not an issue. Definitely, they can go for hair makeups or facial makeups or whatever it is. That is accepted because we don't do that. But treating a skin condition, no, whether which is
Yes.
an acne or a warts or a hair, I think you should not take help from them. So we always guide them to the proper women dermatology. A lot of India is full of women dermatology. Women dermatology is growing in a fast way. Aesthetic and cosmetic clinics have cropped up. Hair care. A qualified dermatologist will be able to address this issue very, very well, and take a small care before you start using anything. We always prefer to do some kind of a procedural dermatology aesthetic from our side. If the disease is there, I think any kind of a blemish or a disease must be treated by a qualified consultant.
Now, to conclude, tell us something about good hair care because that is a big issue amongst women,
Yes,
hair fall and bad
yes,
quality hair and all
yes,
that.
yeah. Hair is a vestigial organ in men and women, but it is need to identify the gender, and of course, the pleasant hair industry is the largest industry across the world, and hair products are available, and of course, hair grows called the anagen phase. It rests, catagen phase. It falls, called the telogen phase. A lot of women come to us with a bag full of hair, and we have seen that post COVID, during COVID, women lot of lost a lot of hair, anxiety, and the COVID virus directly affecting the hair bulbs. We have a condition called telogen effluvium, that is called hair shedding. Any woman can lose hair up to 100 hairs per day for a period of say few weeks. Will go beyond that. That is called chronic telogen effluvium. We need to address that. Don't worry if you lose 10 hair, 20 hairs for a period of few weeks, they all will grow back because hair follicle, the one which sheds out, is called the telogen phase, and regrowth occurs. If there is a kind of a continuous hair loss, anemia, thyroid disorders, local problem like dandruff are the common cause. Uh, then the pattern hair loss. Women lose hair loss like men, called female pattern hair loss. We have the particularly during the middle age 35, 40, 45, 50, the perimenopausal. So we have a Ludwig grade 1, grade 2, grade 3. Minoxidil is the drug of choice. Topical solution is sufficient. We have a peptide molecule. Hair shampoos, anything which sulfate free can be used. And then colored shampoos, coloring. So now people always go for hair colors in
Yes.
the form of a hair dye application. Hair dye allergy is a very common issue. They get a severe reactions if your first applications give you some kind of itchy skin lesions on the hair, scalp skin. Please make sure you don't have a PPD, paraphenylene diamond sensitivity. Definitely, I have women who are coming from the beauty parlor with a swollen eyelid, swollen face, swollen lips. I think severe oozing lesions. So they have a sensitive scalps called the PPD allergy. That doesn't happen to everybody. So you can always, you have an asthmatic, atopic dermatitis is there. Make sure that PPD is be carefully done. We have a, if you have suffered from a PPD severe allergy, non-PPD hair colors are available. Reach out to a dermatologist. He will prescribe you no PPD containing agents. PPD is also they implicated in the carcinogens in women, particularly malignancy, particularly breast malignancy, lymphomas. So if this occurs in the long-term usage, absorption is very common. Of course, home remedies like henna people use everywhere, and hair color is very safe and good. And if you have a sensitive scalp, any reactions, please stop it and then consult a dermatologist so that hair we avoid this PPD containing hair dye. So they can be really, it can be really severe issue. Anaphylaxis can happen. People have to be rushed to the emergency for a resuscitation. It's not easy like you just go ahead because first application you have a mild reaction. The second application you have a severe untoward reactions. We have seen patients who are almost going into anaphylaxis, the PPD. So paraphenylene diamond, which gives you the black color.
That's really nice of you told us in detail. So thank you, Dr. Ravichandran, for joining us today. Could you show us the certificate, please?
Nice, madam.
This is a token of thanks for coming on with us on the show and telling our audience so many useful things.
Mm.
That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show.
Thank you, madam.
Thank you.
Good day. Have a nice day.
Thank you. Keep watching Dr. KK Med Talks. Namaskar.